man's best friend. According to journalist John Webbe, roughly 4.4 million people each year get injured by a dog in the United States. About half of these injuries are from children. So you should listen to me because this information could save your child's life and your dog's life. So research suggests that people don't know how to appropriately interact with dogs. It's also common that people don't know what to do when their dog needs CPR. So in this speech, I will be covering CPR with dogs and newborn puppies, how to interact with dogs, and how to keep your children safe around them. So the 3 important things you need to learn is 1, approaching dogs and interacting with them, 2, creating a safe environment for your dogs and children to interact, and 3, what to do if your dog or newborn puppy needs CPR. So let's begin by going over correct behaviors when you're approaching and interacting with a dog. So, for example, when you're approaching a dog, you don't want to approach them from the front like this, and you don't want to have your hands up or making sharp, jerky movements. You also want to avoid making loud noises, so you're not going to go, puppy, so because that can spook the dog. Instead, you want to approach from the side, and you want to be calm. And if it's someone else's dog, you're going to ask the owner first before you approach. Now, another thing you want to keep in mind, if it's your own dog, you want to enroll them in an obedience training course. This will help them have a healthy relationship with you so that they'll listen to you and follow your commands. Another thing about staying safe around dogs is you want to keep your dog healthy. This will help because an unhealthy dog will act abnormally and it could act aggressively towards other people and animals. To do this, you want to give basic veterinary checkups and you want to keep them up on all their vaccinations. So now let's go over keeping a safe environment for your dog and children. So for this, you want to teach your children not to, once again, make loud noises, jerky movements, and you also want to teach them not to take away their toys and food because this can trigger aggression. It's also wise to supervise your children 100% of the time, especially if they're small, until they have learned the appropriate behaviors to have around dogs. Now, according to Dr. Gary Thompson, a veterinary practitioner, 80% of dog bites come from dogs that the children already know. So it's very wise that you teach the correct behaviors early on and make sure that the dog knows how to interact. Let me change the slide. So there's that one, and then there's another slide too. All right. So basically, make sure that your children know the do's and don'ts of how to approach a dog. Next, I'm going to talk about giving CPR to your dog. So first, if your dog collapses, you want to make sure that you call the veterinarian immediately, or you call the nearest pet emergency clinic. So after you do that, you want to make sure and check the pulse and breathing of your dog. So to do that, you'll see the chest rise and fall on the dog, or to check the pulse, you're going to check on the femoral artery, which is located on the inside of the leg. So if your dog has a pulse but isn't breathing, you're only going to do breath respirations. So to do that, you're going to open the mouth, tilt the head back, and you're going to pull the tongue out and do a finger sweep to check for any sort of things that are lodged in the dog's mouth or throat. Do not do respirations if your dog has something lodged in its throat because this could actually hurt the dog more than help. So after you've done that, you're going to cup your hands just around the nose and you're going to do a 1 breath respiration into the nose. And you should see the chest rise and fall. Now you're going to wait 5 to 6 seconds before you repeat that. So if your dog doesn't have a pulse and isn't breathing, you're going to do CPR, and that involves chest compressions and respirations. Make sure that your dog is on its right side so that the heart is located right next to the elbow on the left side. And you're going to do the same thing. You're going to tilt the head back, open the mouth, pull out the tongue, and you're going to check for anything lodged in the throat. Then you're going to do a respiration, and you're going to see the chest rise and fall. Then you're going to do 5 compressions, and that's 1 second in between each compression. That's 1, 2, 3, 4, 5. And then you're going to go and do a breath. And you're going to continue doing that until help arrives. Now it would be ideal if you had someone with you so that they could call for help and you just start immediately, but if not, you're going to call first before you start. Now if you have a newborn puppy, it's going to be a little different because the puppy is much smaller. So for just respirations, you're going to pick the puppy up and blow directly into the nose, a very short, small breath, because too much will damage the puppy's lungs. And you should see a little rise and fall. Now if your puppy needs CPR, you're going to lay it on its back, and you're going to put one thumb under this elbow and the other fingers under this elbow, and you're going to squeeze lightly 5 times. 1, 2, 3, 4, 5. Now, that's all for CPR. Now that you know about canine safety with your dogs and children, I hope that you take this information home with you to keep your dogs and your canine companions safe at home. Thank you very, very much.